My name is Dr. Brian Gross. I work for LewisGale Physicians. I serve here as an otolaryngologist, head and neck surgeon. I've been here for about 3 years. We see lots of patients in our office with hearing loss. We do have a trained audiologist that is on site, and in patients that suffer from hearing loss, we have it set up so that they come in, they'll get their hearing test. Often it's even before seeing the doctor, and then they'll come in to see us to evaluate their ears and, importantly, to evaluate the hearing test. That then allows us to make recommendations for treatment, whether it's cleaning wax out of the ear, medications that we sometimes use, or recommend hearing aids. Many people suffer from hearing loss. More often than not, it's as we get older. Part of that is a natural process, but there are some things that we can do to keep our ears safe. So a few of those things are watching out with noise exposure. If people are around heavy machinery, shooting guns, anything that's really loud, it's good to use hearing protection. It's more dangerous for patients when it's consistent loud noise exposure, but even with one episode of loud noise, it can be enough to damage the ears. Some things that people will notice when they're losing their hearing is they'll develop ringing in the ears. Also, just difficult time hearing. Specifically, most often it'll be a family member or a friend that will say, "Hey, the TV's real loud," or "I keep having to repeat myself." And those are things that will prompt people to come in to have their hearing evaluated. Everybody has earwax, and a good part of our day is seeing people with excessive amounts of earwax in their ear. Although earwax is very important, it can also cause a lot of problems. So when earwax builds up, it can cause muffled hearing, it can cause ringing, and it can even perpetuate or cause infection of the ear canal. So we will often see patients with excessive earwax, and we can carefully clean this in the office. One thing that we recommend that patients avoid is putting anything in their ears. A lot of people like to use Q-tips. It feels good to clean your ears. The ears are actually made to clean themselves. And when we use Q-tips, it pushes the wax in so far that the ear can't clean itself. Using Q-tips can cause the wax to get stuck. It can cause a hole in the eardrum. It can cause infection. Sometimes little particles of the Q-tips can get stuck in the ear, which then become infected. So there's multiple different ways that we can clean out the ears. Most patients, I prefer to clean the ears under a microscope, so that I'm carefully looking at the wax and then actually manually removing the wax. Less commonly, but sometimes, we'll use a flush of water that will flush through the ear canal, and then that'll help clean the ear out.